Alright, here we go. Hopefully the last and final one. Okay, we got to umbilical cord care. Okay, if you do have any bleeding from a cord that has been cut and clamped, say you got the baby in the nursery and it's having some bleeding, because the clamp, sometimes the cords are so fat, those clamps will not uh, compress enough of the cord to stop the bleeding from the veins in the or from the vein in the arteries. So you may have to apply a second clamp next to the first one. So you never want to cut your cord really, really close to the belly. You want to leave yourself about an inch or so when you cut your cord. You never know when you're going to need to cut down on that cord or if you're going to need it. And it certainly doesn't hurt to have an inch or so sitting out there instead of cutting it down to the bare bones. If your cord stays moist, even if it's pink, you need to notify the doctor because moist cords actually grow a lot of bacteria, and if it's not drying, there's something keeping it from drying. So you want to make sure that you're looking at that. This thing really is slow today. So the umbilical cord should contain, correct, B, one vein, two arteries. All right, we do give injections. We have to hepatitis B and vitamin K are both required by the state. You have to have a consent to give hepatitis B vaccine. You have to educate the parents and give them a handout on hepatitis B before you give the vaccination to their baby. Should be done between birth and 2 days. Now, if you have someone who is hepatitis B positive, if the mom comes in, you have to give them HBIG as well. And that has to be done within 12 hours. But we're not going to be concerned too much with that. Just make sure that you know that the hepatitis B vaccine has to have consent. You'll always want to use a 25 gauge 5/8 needle for the injections. You should give them in the gluteal, lateral gluteal. Vitamin K is given within that first hour and a half of birth. So we want to be sure that you meet your deadline. Circumcision, be sure you're monitoring. Make sure the baby voids before it goes home. Be sure you monitor for hemorrhage, especially if they haven't had the vitamin K on board very long. You want to make sure that you're checking that penis hourly until you're pretty sure that it's the bleeding has stopped. You want to do it more often if you had a traumatic circumcision. Sometimes when they're putting on the Plastibells, they choose the wrong size. Plastibell slips off, and then they end up doing a suturing around or a modified Gomco bell. So you want to, or not a modified Gomco bell. So you want to be sure that you are checking it if there's been any trauma and make sure that they are peeing. So, again, put some pressure. If bleeding's noted, you want to be sure and teach the parents to do that. The reason we put petroleum jelly on and around the glans penis is to keep the diaper from sticking. That's the only reason we do that. Research has shown that with our Pampers that we have been using for 20 million years, and I don't mean just Pampers, but disposable diapers, they usually do not stick to the penis. Cloth diapers did because the blood would, go in and it would form a clot and it would stick into the fibers of the cotton. So we still have not changed our practice. With the Gomco, we're supposed to use the petroleum jelly. With the Plastibell, you do not have to use the petroleum jelly, but some of the doctors still tell you to go ahead and use it. So as of right now, they're still putting petroleum jelly on circumcisions. If a little scab starts to form, please do not try to remove it. That is part of the healing process, especially with your Plastibell. The Plastibell will fall off within 7 to 10 days. So you just want to tell them to be sure and don't use anything but some clean water to clean around the penis, and don't be scrubbing the actual Gomco or Plastibell side. So there are different techniques that are going to actually call for different interventions. Circumcisions are done for cultural or religious reasons. Most of the studies that have been done recently show that there is a decrease in cervical cancer in women that partner with circumcised um, males, and there is a decrease in penile cancer and in urinary infections with males. So the Gomco, or the Plasti, this is the Plastibell, and the Plastibell, as you can see, um, actually they will break off this plastic portion after this has been inserted up underneath the skin, and a string is tied around it. So there is a portion down here and a little portion up here. This portion where it's tied, when this skin actually will heal, and it will actually all fall off at one time. So um, it will just it'll fall off in about 2 weeks. And remember not to um, remove the exudate there. With your teaching, be sure you're when you're teaching about to these moms about their babies, you're going to have to use your teaching learning principles. And I can't reiterate that enough, that you need to know what those are. You need to assess the mom's level of knowledge. You need to see how much does she know about what you're fixing to teach her about. If you're teaching a mama that's got 10 baby boys about circumcision, you were probably wasting your time, unless she's never had them circumcised and decided to circumcise her 11th one. So assess their knowledge, assess their level of knowledge, assess their learning methods, assess how high of a grade level that they understand things. Be sure you're using those teaching learning principles, and you tell me about them, or you're going to get counted off for them on your clinical reasoning tool. So once you've assessed your mom, you need to go through all the stuff you need to teach them. If it's a first-time mom, you need to teach them everything. So in the best case scenario, we're teaching all moms that are just new to the babies and don't have a bunch of babies at home. But if they do have a bunch of babies at home, that will be told to you. So, review with the mom what can cause an elevated body temperature. If they're wrapped too warmly, be sure and tell them to take the clothes off of them, retake their temperature. Then if they still have body temperature, they can call the doctor. Signs to report: high, low body temperatures, fussiness, stuffy nose, lethargy, all these things, poor feeding. Ways to be sure that their baby keeps a normal temperature is to be sure that they don't put them in cold bath water. Be sure they dress them appropriately. If it's hot to you, don't dress your baby in winter clothing. Protect them from excessive sunlight. Babies that are 6 months old and younger shouldn't have sunscreen used, to be kept out of the sun. Be sure you teach them how to do axillary temperatures. And you also want to teach them how to do the rectal temperatures. These are things you need to teach them. Parents should plan for a healthy follow-up for at least 2 to 4 weeks of age, and then every 2 months, and so forth and so on. Babies who are breastfeeding should be seen 2 to 3 days after discharge, simply because they may not be feeding well enough. So you need to make sure that they are eating well. And you want to make sure you're monitoring for jaundice. You're going to make sure you're monitoring for dehydration in breastfeeding babies. So speaking of breastfeeding babies, let's talk about nutrition and feeding. Full-term infants should double their weight by 5 months of age. Triple it in 1 year. We talked about the 10% weight loss they usually experience in that first few days, because they have all that insensible fluid loss, all the fluid from their lungs. It's not really that they're losing fat, they're just losing some excess water fluid, or water stuff that's in their lungs, and their urine and their stool and all that stuff that they haven't passed. And usually, of course, by the time they go back to see their doctor, they've gained back what weight they've lost. Their length, their height usually increases about 50%. And by the time they're 4 years old, they should be doubling their birth length. So feeding readiness, we really have to make sure the baby's ready to feed. So What determines whether they're able or ready to feed is maturation of the central nervous system. If we have an immature central nervous system, then we're not going to have all these reflexes that we need. We need the rooting, sucking, and swallowing reflexes to be present at birth. And if they don't have these and they don't have a good handle on them, then we're going to have difficulty with these, with the baby eating. The baby will give you hunger clues that you need to be talking to your mom about. You know, especially breastfed moms and new moms. They don't really know when to feed the baby. Sometimes they think if the baby wakes up, even though it ate 30 minutes ago and it wakes back up, they think they're supposed to feed it in a bottle and it's already took 3 ounces. And this is where we end up seeing moms and babies not getting along because the babies are spitting up everywhere. They're overfeeding them. Breastfed babies, on the other hand, will give these clues that moms don't pick up on, and then they get extremely agitated because nobody's meeting their hunger clues, and then they get so excited and mad that they're not going to latch on. So you need to be sure that you determine whether it's a formula fed baby, breastfed baby, what clues you're going to be looking for, like bringing the hand to the mouth, or rooting around, or mouthing on their blanket, sucking motions while they look like they're asleep. So we want to begin feeding them before they start before they start crying and get really distraught. We don't want to start solid foods until they're 6 months old because of that extrusion reflex. I don't want to be sure. Want to be sure we're not giving them anything with added salt. When we do introduce foods before 6 months, it's going to put our babies at risk for allergies. Even when they're 6 months old, we should start with rice first and then work our way up. So you want to make sure that you know which foods you should be avoiding that might be more allergic to than others, such as eggs, honey, lactose intolerance from cow's milk, strawberries, oranges. Neither breastfed babies or bottle-fed babies need to be fed water. And I know you and Miss Medley went over this in Fluid and Electrolytes. Neonates and infants do not need to be fed water. The only time they should be fed water is if they're over-consuming formula. Babies never over-consume breast milk. They need all the calories that they get from their formula and their breast milk, and the formula and the breast milk has adequate fluids to meet the fluid needs of the infant. So they should not be fed water. In third world countries, they mix their formula to a third of what it should be and feed them water because they don't have enough food to feed them. And we just really highly discourage, especially moms who are of low social economic status, to give water to their infants. They just starve their infants. We don't give fluoride supplement unless they're 6 months old and they don't have fluoridated water, which most places have fluoridated water. So we want to make sure that we're doing that. All right. To one of my favorite subjects in all the world. Breastfeeding has a lot of barriers, and one of the main barriers is the hospital and the practices that are within the hospital. We will see at Unity that we separate the moms and the babies. Babies are admitted to the nursery. Moms are left in the postpartum rooms. We will see at White River Medical Center that the moms and the babies are rooming in the same room, and they are only separated very brief periods of time and then are left together constantly in the room together. So breastfeeding is very much dependent on how much interaction there is between the mother and the baby. So the mother has to be aware of when the baby's ready to eat. It doesn't depend on whether a nurse in the nursery sees that the baby hasn't eaten in 3 hours and they wake the baby up to go eat. They may have missed some clues that the baby was ready to eat an hour ago and went back to sleep before anybody noticed what was going on with the baby. We need to stop test feeding with sterile water. It's absolutely pointless. They shouldn't be on a feeding schedule. Let's feed this baby every 3 hours, unless, of course, it's medically indicated. Another thing that deters breastfeeding is that we are so used to formula fed. How much did the baby eat? Well, we can plainly see how much formula the baby took down, but we can't tell how much actual breast milk came out and how much the baby got. So we either measure the feeding by ounces or by how many minutes they stayed on the breast. If we're saying it stayed on the breast for 10 minutes, did it stay on the breast continuously for 10 minutes? And did it suck continuously for 10 minutes? Did it have a strong suck? Did it have a good latch? These are things that that kind of deter, because doctors want a measure there. Keeping those infants in the nursery is a bad thing. And of course, we always provide free samples of formula because the formula companies give it to us in nice, pretty little diaper bags. And we want to make sure that moms get their little diaper bags. So, at the beginning, breast milk comes in colostrum. Colostrum is thick, has increased amount of proteins and decreased amount of fats, and it contains antibodies. Our 2020 people goal is to increase breastfeeding. They've not been very successful. Most breastfeeding moms, they start out usually end up by 6 months, hardly anybody is breastfeeding their infant exclusively, and it's very seldom that you get them started out in breastfeeding that they actually stay exclusively breastfeeding for the first 6 weeks. So we're not meeting our goals of what we're trying to get done. When we give a newborn a bottle, it interferes with their ability to learn to breastfeed. When they are instantly satisfied with sucking on a bottle, then they don't want to work at sucking on a breast. They have to suck on their breast for at least 5 minutes before the milk letdown will actually occur. So they're not getting anything for the first 5 minutes that they're on the breast, more than likely, unless of course mom's leaking and ready for breastfeeding. But when you first get started, in order to have that letdown, the baby has to nurse for quite some time before the actual letdown occurs. Breast milk is species specific. It's optimal nutrition. It's going to minimize exposure to foreign proteins. It's customized. It helps promote mother-infant attachment. It decreases health risk. It decreases gastroenteritis. It decreases otitis media. It decreases respiratory infections, decreases RSV, necrotizing enterocolitis, and UTIs. Breastfeeding is a wonderful thing, and it works. It helps and improves their ability to learn. They actually have a higher scoring, mentality scoring. So there's a lot of things that breastfeeding are just really good for. So here's some things that good for mom. Lactational amenorrhea is going to protect mom's iron stores. We have a young lady who has been breastfeeding for 6 months and she has not started her period yet from having her baby. So she is protecting her iron stores. The longer she breastfeeds, if she breastfeeds for the whole year, the less risk there is for premenopausal breast cancer. Remember, oxytocin, when it's released, promotes that letdown of milk, and usually it's the tugging of the nipple that causes the pituitary to release the oxytocin. The prolactin is what's necessary for lactation. So the prolactin is what helps make the milk, and the oxytocin is what does the letdown. So prolactin for production and oxytocin for letdown. Breastfed babies will usually have 2 bowel movements every 24 hours once the milk is established. Once they really get their milk established, some will have a bowel movement every time they eat. And then again, other babies may go several days without a BM because they may not be using up all the breast milk they're getting to keep up their metabolism. So don't be offering babies pacifiers or bottles that are breastfed babies. Early and late effects of breastfeeding, we usually have improved survival. And the babies have a protection from acute infection, and of course, it improves their cognitive function, especially in premature infants. It provides them also in later years protection against obesity, diabetes, bowel disease, cancer, SIDS, and hypertension. Premature infants, it 60% to breastfeed them, it decreases their risk of developing necrotizing enterocolitis by 60%, which is awesome. It also helps keep down the possibility of sepsis. They have better feeding tolerance. It doesn't take their digestive system as much work to digest their food. Um, they usually have less residual, and it keeps them from having, they have less incidence of retinopathy of prematurity when they're receiving oxygen. So breastfeeding is just so wonderful. So be sure that we are helping by helping to facilitate latch on. Make sure the baby's body is in alignment, that the head and the shoulders and the butt are all aligned, that the baby is belly to belly with mom, whether they're laying on their side or laying, and mom's doing the football hold or doing the cradle hold. They should be skin to skin, belly to belly with mom, and should be in alignment. The baby should be brought to the breast. Don't bring your breast to the baby, because that will cause you to be in a severely cramped position. You'll be uncomfortable. Baby will be uncomfortable. When you go to straighten up, you'll pull everything out of the baby's mouth. It's bad, bad posture to have. If your baby is latched on correctly, you will see rounded cheeks. You will not see their cheeks sucked in or dimpled. The infant's jaws are going to glide smoothly. Arms are going to be relaxed, maybe patting on the breast. And mom should feel just a tug. She shouldn't feel any pinching or biting sensation. Babies actually do a chomp, suck, chomp, suck, chomp, suck. So they're not really doing just continually sucking. They do the chomp to help with the milk letdown, and then they do the suck. So what are some signs of letdown? The baby suck and swallow pattern. So when you are monitoring a baby to see if they're breastfeeding well, and you're watching for the latch, and they have a nice round little cheek, their jaws are sliding back and forth like they should, good movement there, and you're seeing a little bit of a chomp and a suck, their suck and swallow pattern should change from being really rapid and shallow to being really deep and slow, so that they're sucking and swallowing. Usually mom can tell that their breasts are softening during feeding, because the milk is let down and started coming out. She may even feel sleepy. That's usually because of the release of the oxytocin. Sometimes mom's going to experience that increased lochial flow or uterine cramping that we've already talked about, and the opposite breast may leak. Those are some things that you're going to be watching for signs of letdown. And this is what you want the baby to, before it goes to the nipple, this is what you want. Mouth is wide open. She started out with the baby's nose to her nipple. When the baby's nose was rubbed against the nipple, the baby responded by opening his mouth very wide. You can see this is really, really wide. When she brings that baby up to her breast, that nipple is going to go back into the throat. This part of the mouth is going to latch right here and come up and over. So she's going to bring the baby up and over, just like you'd take a Big Mac sandwich. Just imagine you've got a Big Mac sandwich and you're fixing to bite into that. You don't just bring it straight to your mouth. You bring it in at an angle, and you open your mouth, and you bring your mouth up and over that Big Mac to take your first bite. And that's the way these babies need to be before they latch. If this baby's mouth is any smaller than this, he can't get this area. This nipple and as much of this areola needs to go in the baby's mouth so that the baby has a proper latch. So mothers who breastfeed, the vegetarian mothers require vitamin B12 supplementation. They need to drink fluids to quench their thirst, but don't tell them they have to drink a lot of fluids. They don't need a lot more fluids. Body's perfectly capable of telling you when you need to drink to increase the amount of fluids you need to increase your breast milk. Some may experience some weight loss with breastfeeding, but it's not really a good weight loss to tell them, oh yeah, you'll lose weight when you breastfeed. It's not one of those things. Moms do have a lot of benefits from breastfeeding for themselves. For one thing, it promotes that uterine evolution so that when it does help her lochia eventually uh, go away quicker. It decreases the chance of postpartum hemorrhage because you're breastfeeding every couple of hours, oxytocin is being released, and the uterus is being clamped down. It decreases the chance of ovarian and breast cancer. It's an earlier return to pre-pregnancy weight if you exclusively breastfeed, and it's also a decreased risk of osteoporosis. Society also benefits from the mother who breastfeeds by decreasing healthcare costs because babies are healthier. It decreases employee absenteeism because healthier babies means moms don't have to miss work. It's very convenient in the fact that it's already mixed and ready to go anytime the baby's ready to eat. And it's environmentally friendly. You don't have to worry about having disposable bottles and things to throw away. Jesus. And we're going to stop here. Hang on.